Hello, I'm Dr. Robert Henderson. As a member of the healthcare community, it won't be any news to you that our industry is in crisis. Healthcare and insurance costs are spiraling out of control. Millions of working families are without health insurance of any kind, while those with coverage struggle to meet rising premiums and co-pays. We've actually reached the point where even the biggest companies can no longer offer a complete package of health benefits for their full-time employees, or any health benefits at all for part-timers.
What could be an unhappy game changer for millions of Americans struggling in these tough times. Right now, 28 million Americans have jobs but no health insurance. But that number is likely to shoot up because of a controversial move from the nation's largest private employer, Walmart. ABC's David Wright explains.
Everyday low prices for everything but the health insurance for all those nice people in blue aprons. Walmart's plan is already so expensive, many workers can't afford it.
I can't afford the health insurance that they offer, even though that I'm full-time. I make $9.80 and I am a department manager.
Walmart had been offering coverage to part-time workers. Many companies don't. Now the world's largest retailer is dramatically cutting coverage to part-timers and raising premiums for everyone else.
They're caught between a rock and a hard place. Healthcare costs are rising, and they have the pressures of the weak economy.
Next year, the most popular health plan Walmart offers will cost workers 36% more. New part-time workers won't even be offered health insurance unless they work 24 hours per week for more than a year. It's a national trend. Workers are paying more for less. An astonishing 14 million Americans work full-time but have no health insurance because they're either ineligible or can't afford it. The numbers are staggering, but it's here that you really see the scope of the problem. This is a free clinic set up in an LA sports arena, the sort of thing you normally see in a disaster zone, except these people are just seeking routine care. Some of these people have insurance, but the deductibles are too high, or the policies don't cover things like dental care. Felicia Castro lost her insurance when Estee Lauder laid her off last year. Today, she learned there's a lump in her breast.
It's really, really tough.
And you've got a lot you're balancing right now.
I'm here because I need help. And that's, you feel shame in it, in a sense.
In addition to a mammogram, she took advantage of the free dental care.
In order to have the opportunities of persevering in the job market, you have to have a beautiful smile.
But in this economy, there's not much to smile about. David Wright, ABC News, Los Angeles.
The situation is forcing people to put off regular trips to the doctor for proactive or preventative treatment. As a result, easily treatable symptoms become serious, costly illnesses. This trend has contributed to a rise in absenteeism, costing employers even more in lost productivity. Families, employers, and healthcare providers all need a practical, affordable alternative to expensive insurance and cumbersome government-sponsored programs. Jeff Vitt, CEO, will tell you about an innovative program called PATHCare, Personal Access to Healthcare.
You can't pick up a newspaper, watch the news, talk to an employer or an employee without hearing the frustration of the rising cost of health care and workers' compensation coverage, or the numerous advantages of prevention and education. In 2004, I began putting the pieces together and getting feedback from employers. The need for a different approach was obvious. Our delivery models were already in place and operational to deliver more than just prevention, positioning us to provide an even larger return on investment to employers than just basic screenings and education. The challenge was aligning and communicating an innovative approach that was new and different. In 2008, I committed time, money, and resources to bringing PATHCare to the market. Significant interest and progress was made quickly.
The PATHCare solution gives employers a way to provide employees with access to a continuum of care, with an emphasis on prevention and follow-up. Employers pay a low monthly membership fee per employee. For this, employees and their family members share a generous annual allowance of doctor visits, along with a flexible spending account for clinical services. And unlike insurance programs, the PATHCare approach gives them full control over how they use their allotments. Members are also entitled to biometric screenings and on-site health risk assessments, as well as personalized wellness education. To provide truly customized levels of care, PATHCare leverages the services offered by its different divisions. They include Star Medical Group, which provides family, occupational, and urgent care services. Flu Shots of America, to beat the flu, we come to you, provides on-site immunizations and is complemented with ProPrev Health, our center for customized on-site employee wellness programs. PATHCare Medical Memberships is a new direction in family health, which bundles these individual models into one simple, comprehensive solution.
ProPrev, Proactive Preventative Health, is a division of PATHCare that introduces the employer and employee to preventative care. We start by providing the employee with biometric screenings to test cholesterol levels, glucose, triglycerides, blood pressure, and body mass index. We then take the results from the screening and enter them into a health risk assessment. Along with the health history of the employee, we provide them with a full color report of their current health and disease risk factors. The employer is also given an aggregate report which shows the overall health of the company. The aggregate report helps ProPrev and the employer build a customized employee wellness program for the company. Another important aspect to the biometric screenings and health risk assessment is the follow-up with the employee by one of our medical providers. This allows PATHCare to keep the employee in the continuum of care by giving them access to our other divisions, Star Medical Group and Flu Shots of America, as well as referrals to preferred medical specialists and hospitals. Healthy employees make happy employees.
The advantage of this multifaceted approach is to provide different points of entry into the PATHCare network of providers. Now it's time to take the next level, to offer a complete continuum of care, where we must expand our range of services to include quality hospital care and specialist treatment when needed. To do that, our plan is to partner with physician-owned hospital groups and associated specialists. We believe that these entrepreneurial organizations are the right fit for PATHCare, and we believe that partnering with us will offer them a significant advantage. Typically, such organizations cannot match the marketing budgets available to nationwide hospital chains. By affiliating with PATHCare, they will have access to a growing stream of referral patients as more and more employees come on board. Perhaps even more important, participating providers won't have to deal with billing, follow-up, or even collections. Instead, they'll be paid quickly and directly by PATHCare. To make this exciting option available to employers and families throughout North Texas and beyond, we must expand our network of care points and develop, encourage, and support more participation and next step information based on individual results of on-site programs. This requires significant capitalization, which in turn creates opportunities for qualified investors.
Major increases in employee contributions, co-pays, and deductibles, as well as what employers are enduring, confirms that there has been a shift in the economics of healthcare. PATHCare is not insurance. It is designed to complement insurance coverage or provide access to primary and preventive care. Regardless of Obamacare or healthcare reform, the facts are crystal clear. This approach is effective, flexible, practical, and overall sensible to the employee and employer.
For more than a decade, we've all watched the healthcare crisis deepen. Individuals, families, employers, and even physicians are desperate for a solution. Clearly, the present system is broken. It's time to move beyond the status quo, to introduce fresh ideas, innovative approaches. That's exactly what PATHCare provides, a flexible, cost-efficient solution that encompasses the proven benefits of wellness education and preventative care, as well as access to personal care from providers focused on efficiencies and outcomes. We are fully committed to bringing this solution to the marketplace as rapidly as possible. The time to act is now. We invite your questions, your ideas, and especially your collaboration.